regarding the new Artevo 850. The key points are the filters, the OCT, the depth of field and the phototoxicity.
I think DORC and ZEISS getting together was a really great decision. They perfectly match together. They have now a portfolio where they can cover all you need for intraocular surgery. Our eye clinic is in the center of Munich. It's one of the largest eye clinics in Germany and as well as in Europe. We do about 8,000 surgeries a year.
So when we see a patient the first time, we of course examine him perfectly. We'll take pictures of his fundus. We will also do an OCT of the macula and of the papilla, just to be sure to have everything imaged. I think the Forum software is super intuitive because you have everything per mouse click, whatever you want to know. We can do all the calculations for IOLs. We can visualize all retinal problems prior to surgery, during the surgery, and after the surgery. Therefore, it serves a super tool for clinical routine.
When we're talking about the advantages of working with 3D heads-up system for anterior prostate segment surgery, including intraoperative OCT, for the Artevo 850, for the ZEISS system, we have the big advantage that preoperative diagnostics and intraoperative work is kind of connected together now. And this is something you feel really comfortable because it's one world, because you always have it with you in your. We're going to implant the toric intraocular lens using the Callisto. And of course, first we have to look for the reference. And you can either see it on the small screen, but also on the big Artevo 850 screen. And we can see that both images match, perfect calibration. And now you can see the axis is going to be 88 degrees for our toric intraocular lens. Okay, doing combined surgery, I usually do first insert the trocars. The reason for that is that when I have a stable situation, not a low pressure, by doing this maneuver, I will see with the NEXUS, the EVA NEXUS, we have a very stable anterior chamber. This is a big advantage compared to the EVA, to the old version. Cataract surgeons will love it. We now have a machine which is also performing perfectly in the anterior segment, but still stays the master for posterior segment surgery. This is the big advantage we now have with the EVA NEXUS. Usually implant the intraocular lens using irrigation. You don't need viscoelastic because the anterior chamber stays stable.
My name is Rodolfo Mastropasqua. I work as a full professor of ophthalmology at the University of Chieti Pescara, and I lead a team of around 20 doctors and ophthalmologists and around 30 orthoptists. So the new Callisto platform is completely different from the previous generation microscope. It's really easy to use and very intuitive and easy also for my staff. So the ultimate reason why I used to adopt 3D is because as a vitreoretinal surgeon, I think you can deliver the best care if you have the best visualization of the surgical field. I'm gonna use this new microscope that is the Artevo 850, which is a new machine that I'm proud to be the first user in Italy. It's a new machine that gives us the possibility of using both 3D and hybrid mode, so you can easily switch from 3D to ocular mode. So compared to the other machines, you don't really need to do the parafocality, so you can avoid to waste time in this. You just have to put on focus on the corneal apex, like this. And then you can adjust the focus. This is a good point because the depth of focus is something that be a little bit difficult for first user of 3D. Whereas with this technology you don't really need to switch the focus a lot of times during the procedure. You always maintain the same amount of focus.
Talking about the improvements of the ARTEVO 850, one should not miss the dynamic enhancement, which means that we need less light and still have a bright view, good visualization, which is really great for surgeons, but especially for our patients.
Perfect visualization also from anterior. Concentrate on the opening of the cutter. This is the area which we want to have in focus. But still, and this is the main reason for that, is the depth of field. We still see the sharp edges of the intraocular lens. So the new ARTEVO 850 has definitely a much higher depth of field compared to the old version.
Okay, now we switch to the REISS side.
At the moment, we are working with 15% of light, which is quite low compared to what is the percentage we are used to during the ocular mode. So this is good because it gives you the possibility of working with a low percentage of light and so avoid the phototoxicity. So when we operate on this kind of patients, rather than retinal detachment or diabetic patient, we really need to be less toxic as we can. And this is good because the lower amount of light you project, the best prognosis in these delicate cases you will have. So I show you the difference between these. This is the standard color and the vitrectomy blue. That is one of the filters that this machine has and give us the possibility of clearly see the vitreous even better. In these cases, you really need to see what you are removing, and this helps a lot. Because with these new filters, you can enhance some details during your retinal surgery that were not visible before. So it's really, really useful.
There are some features which now have improved with the ARTEVO 850. One is the visualization with special color filters. So for example, the peeling filter, which is kind of blue, definitely improves the contrast for peeling epiretinal structures like the ERM or the interlimiting membrane.
But the idea is to release the traction here, the connection to the EVR membranes. By removing the ILM in this region, there's actually no way for future PR structures here, which might be a problem for the fovea. And once more, you can see the perfect visualization by using the additional blue filter. Always try to go from the periphery to the center. Okay, jetzt machen wir OCT. You can see the lamellar hole. So it's a real improvement compared to the old version. That's actually really exciting for me, to be honest.
Which was a real positive surprise for me was the improvement of the intraocular OCT. Now we can see tiny, fine structures, fine changes, which is really helpful in decision making. And this is a really big step in the 3D heads-up surgery.
Okay, fantastic. So here you can see how the quality is improved. You can see the packer. We can take a shot of the packer photo and then you can compare. I will show you in a second with the post-peeling. So I found the new integrated OCT extremely useful and extremely improved compared to the past. There is a double resolution of the OCT, and this helps because during the procedure you can visualize the scan. You can have in the same time the vertical scan and the horizontal scan. And so you can do a induction of posterior vitreous detachment. You can see guided on the OCT, an exact idea of your posterior vitreous detachment induction. And now you can complete your procedure. So with the foot pedal you can check the pre-op that you can see on the left-hand side and the post-op that you can see on the right-hand side. You can see the membrane removed and you can see this live, and also check if there is any remnants that you have not removed in order to do it. I can say that I felt much more confident working with this new OCT, and it's really a plus in my surgery.
So I would say it was a really exciting day today. First time working together with the ARTEVO 850 and the DORC EVA NEXUS. This was a really great experience. My expectations were absolutely met, honestly speaking. There also was one game changer. This was the intraoperative OCT. I'm really happy with this new device, which actually is now really a device I, in the future, definitely will use more often than I have been using the OCT, the intraoperative OCT, until now.
Good characteristics of the microscope are the new OCT that is dramatically improved, the depth of focus, the smart depth of field that is really stable during the whole procedure and makes the procedure easier, and the illumination. It never happened in my hands to work with a so low amount of light, 15%, for the all procedures I did during these weeks. And I would add also the filters that are a plus. They change the way to see the surgery you do, because you see different features that you never explored before in standard surgery. Grazie mille, grazie a tutti. Ho finito, è andato benissimo, signore.
Mamma mia.
Eccoci qua.